Is it all doom and gloom when glaucoma threatens to rob one's eyesight?
And find out why the optic nerve is oh so delicate and important.
All that and more on
Everybody knows.
It has often been described as the silent thief of sight. And that's because it typically progresses without noticeable symptoms in its early stages.
What ensues is a gradual loss of vision on the affected eye as it continues to lurk behind until the damage becomes significant.
Thank you so much for joining us for another episode of Everybody Knows. And that's right, glaucoma is the eye condition which we're going to be looking at today.
Yep, and to share his medical knowledge and insights on glaucoma is Dr. Jayant V Iyer. Come on out, Doc.
Hey, Doc.
Hey,
All
welcome
right.
to the show.
Thank you very much.
Looking
Thank
sharp.
you very much.
Yeah. Great to have you here with us.
Nice to see you.
Yeah.
Great to have you with us. Thanks for joining us.
Alrighty.
Okay, I've got to ask you one of the most basic questions about glaucoma. What are the common causes of glaucoma?
Glaucoma essentially is a condition wherein the optic nerve of your eye gets damaged slowly, sometimes quickly, and that could result in irreversible loss of vision.
Okay.
So what is the optic nerve? So if you were to look at the eyeball, so light goes in through this transparent button that's called the cornea, and it goes through the pupil, and within the eye, much akin to a camera, there's a lens. When you're young, the lens is clear. When you get older, it may get foggier. Light goes into the lens, and then it gets captured in this bowl that we call the retina, or the retina.
Okay.
And the retina then captures these signals, transmits it through this cable that connects the eye to the brain, and that cable is what we call the optic nerve. So in glaucoma, what happens is that this structure gets damaged with time. When it gets damaged, it loses function. And it loses function over time, you lose vision. And that condition is called glaucoma. And one of the commonest risk factors for it is raised intraocular pressure or raised eye pressure. Because like any structure, the eyeball needs to be kept in shape with fluids and the like. The fluid gets produced, it gets drained. And there's an equilibrium. So it maintains it at a particular pressure.
So what causes the pressure?
Sometimes the equilibrium gets into an imbalance. So the pressure goes up because the drainage system is a little inefficient. Either it gets blocked or it gets faulty, it gets clogged up somewhere.
So what are like some of the telltale signs of glaucoma, starting to come on? It seems like this would be tough to catch.
Typically, you don't know that you have it. It's asymptomatic for the large part of the disease.
Oh, that sucks.
In fact, almost 80% of participants in this large-scale population studies were unaware of the eye condition they had upon screening. There's a condition called angle closure glaucoma, wherein they can suddenly get one eye that's red, painful, along with blurred vision. And that can be a result of angle closure glaucoma. So if you remember, within the eye, there's a fluid that gets produced inside here. It drains through the pupil, and it drains in a structure we call the angle, which is the space between the cornea, which is the clear button of the eye, and the iris. That structure is called the angle. In many patients in Singapore, a bit more commonly in Chinese, this angle, the structure where the drainage system resides, is narrower.
Right.
And then it suddenly occludes, it gets blocked off. So that's a mechanical obstruction of the drainage. And then the pressure can suddenly build up. They get red eyes, hearing, painful eyes. They may get halos around light. They may get nausea, vomiting because the pressure is too high.
Is it true that some people with extreme short-sightedness, they are more likely to develop glaucoma?
Whenever we classify disease in medical literature, we call them primary or secondary or essential or idiopathic. It's just a fancy way of saying we don't know. It just happens, typically age-related, genetic-related. People with extreme short-sightedness or high myopia, as we would call it, and unfortunately Singapore has the dubious honor of being the myopia capital of the world.
Is that right?
Yes, we do. We are number one, unfortunately, in this regard. So these patients who have very high myopia, where the eyeballs are a bit longer than usual, they tend to have thinner nerves, so to speak. High myopia has a 3 times higher chance of getting glaucoma. Not that they will, but there's a higher chance. So the answer, that's a long answer to saying yes, extreme short-sightedness is a risk factor. There are others too, like steroid usage. People on regular steroid inhalers, creams even though it's nowhere near the eye, the steroid somehow clogs up the drainage system in our very minute structures within the eye. Trauma, injury to the eye, infection. These are secondary causes of glaucoma, where there's a known cause, poorly controlled diabetes, when the blood vessels are leaking. So primary is wherein you don't know the cause, it just happens as a single disease entity, and we need to address it. Secondary is when there's another known cause, which we need to also tackle alongside the glaucoma itself.
I think it's time for us to bring out our guest.
Let's do it.
Yep, she's a veteran performer who continues to stay active and engages us with her powerful vocals and enthusiasm.
And he's best known as the beloved character from The Noose, who just loves to, what is it, jog it?
Jog it means
jog
to
it.
dance.
Jog it. All right, hey, jog it. I like to jog it. I like to jog it. All right, let's go ahead and welcome Rahim and Suhaimi Yusof.
Hello. Jog it. We thought you were going to jog it out.
Yeah.
Hello. Welcome to the show. Hello.
Thank you. Welcome to the show. It's
Nice to have you. All right.
Joget.
Okay, so
Thank you. Joget.
Emina Ronggeng.
Okay, so Dr. Jayant, I'm curious, what is interocular pressure and what's considered a healthy range?
Intraocular pressure or eye pressure refers to the kind of pressure that the eye is kept at. So it's the equilibrium we were talking about. Typically, and I say this with a bit of caution, the pressures range from 11 to 21 millimeters mercury. But there are many a time when patients have a normal eye pressure and yet their nerve is damaged because of glaucoma. Having said that, there are many patients too who have a high pressure, higher than the normal range, who do not have glaucoma. So it doesn't mean that you have a slightly higher pressure, oh my God, you have glaucoma. It doesn't mean that.
I do want to ask our guests, have you all gone for a glaucoma test?
Yes, I did. I went for my eye check, and the pressure was 13.1.
That's the intraocular pressure.
Yeah.
Is it?
Pressure.
Okay.
Yeah. So how's my IOP for today?
I have just the right person to help check your pressure today.
Okay.
I have my chief optometrist from
Okay.
the Straits Eye Center, Rachel, who's going to come here and show us how we do a simple eye pressure check. To welcome
we
you on
have
board.
Rachel.
Hello, Rachel.
Hi, Rachel.
Come join us, Rachel.
Okay, cool. So we're going to actually have a test here. That's
Oh, she's got to be on this side, right? Okay, her right side. It's actually touching the eye.
Yeah, it's
Yeah,
like
yeah.
a little,
It's
like
tickling
what looks like a
actually.
silicone or rubber thing
Wow.
that's just actually.
Also
this is
13
as well. Wow.
13.
The best part about this device is I don't need to give any numbing eye drop.
That thing is like punching the eye.
Yeah.
And 18.
18.
Thank you.
So remember, once again, word of caution. Normal pressure doesn't mean you don't have it. It just is, you don't have a high risk factor for it in glaucoma. Of course, you need to get your eyes checked.
Thank you.
Wonderful
Thanks
job,
so much,
Rachel. Thank you so
Rachel.
much. Thank you so much.
Thank you.
So that's not the only thing, right? So what do we check when we assess for glaucoma? We check, obviously, a patient's visual acuity. That means their vision. We don't know the typical charts when you go to a glasses shop. We make it look
Yeah.
straight. What number can you see?
A, B, 1, 2,
Right.
made
Yeah.
in China.
And then,
That's
and then we kind of check your degree. That's one thing. So visual acuity is an important component, of course, for any eye disease. So we need to check the cloudy vision that you say you have. I
Yes.
need to check that. Then I need to check your eye pressure, which we have done. Then we will check the structure of your eyes to see whether it's occluded or not. Most importantly, in fact, is the nerve. So this is how you look at the screen. The thing that looks like the sun, that's the optic nerve.
Yeah.
And next to it, you see this black spot on either side. It's called the fovea. We digress a bit. That area is important for your central vision and color vision. So now the next picture, look at the nerve here. It doesn't quite look as pink. It looks a lot more whiter. And that rim of pink that was suggestive of healthy nerve tissue is nearly depleted.
Right.
It's kind of fully damaged. But ultimately, glaucoma is a condition that affects this nerve structure and it makes that get damaged. It makes you lose vision.
I've got a question. Each eye has one optic nerve, right?
Yes.
What are its unique characteristics and why is it so important, basically?
That's what sends the signal. So your eye receives signals. It captures it in the retina, which is the bowl that you saw. It sends it through this optic nerve that looks like the sun. That connects to the brain. Our brain processes images and then we see. If that signal is cut at its source, you can't see anything.
I have a problem with my nerve on my right. So the doctor just checked on me and he says, a little bit with your nerve, there's something wrong. But he said, let me do the cataract first.
In your case, from what you're describing, So imagine when you're young, the lens is clear. When you get older, it gets cloudy, like you described. And even if the camera is good and the SD card is fantastic, you can't get any images. So all I do is I'm like, replace your lens with a new artificial lens that should get you brighter, clearer vision.
That's awesome.
And you can see clearly. I can see clearly at the back of your eye to see what's going on with your nerve or the retina. You know what I mean?
Yes.
Don't worry, Kaka. He
No,
will
because-
get on your nerve.
All right, everybody, we're going to go ahead and take a break. When we come back, we're going to find out how a 76-year-old glaucoma patient continues to live life to the fullest. Welcome back to Everybody Knows. 76-year-old businessman Peter Lim was all set to enjoy his retirement until he found out he had glaucoma in his left eye.
While learning to live with his deteriorating eye condition, Peter remains diligent in following his doctor's medical instructions and maintaining a positive outlook. Here is his story.
I love fishing, DIY and gardening, and I will not let my ailment impede any of my activities.
76-year-old Peter Lim is prepping for yet another overseas fishing expedition. To address the glaucoma condition on his left eye, the retired businessman underwent an eye trabeculectomy in July 2024. This surgery served to create a new pathway for fluid inside his eye to be drained.
When it first hit me, it was a total surprise. I was having a shower and then suddenly my left eye started to cloud. It is like as if you are having a cloud passing through your eye. Within an hour, I can't see anything on my left eye. I was really shocked. I thought I was going blind. Then we immediately rushed to the hospital to see our doctor. It was determined that there was a virus and possible start of a glaucoma. For 14 years, I had very good vision. 2020, when the glaucoma hit me, it comes and goes. That means when it hits, it comes very fast. Within the hour, I would have lost my left eyesight. And then I would have to quickly rush to see the doctor, and I cannot drive because I'm only left with the right eye. And so vision is not good. I will also have a lot of halos at night. So the only thing I could do is stop any activity that I have for a short while. Once my eyesight regains itself, then life is back to normal. When the doctor prescribed the medicine, one was the tablet and the other was the eye drop. The tablet immediately controls the pressure, but it also had a side effect. I have no control over my bowels. That means if I want to urinate, I must urinate within 2 seconds. If not, I will pee in my pants. The eye drops were just eye drops. You use 3 times, 4 times, every 3 hours, 4 hours, depending on the severity at that point. So once that pressure drops, then things go slowly back to normal.
Although Peter would follow the doctor's instructions and apply eye drops religiously, his condition did not improve over time. In fact, his eye turned bloodshot when he was traveling in the United States, and it got Peter very worried.
Throughout the 45 days, the pressure didn't come back, it didn't hit me. But my eyes became red, bloodshot, and then it dried, the eyelids dried, and they began to bleed. So when I got back to Singapore, I rushed immediately to Dr. Jayant, and he said the medicine was good, but it had an allergy effect. Actually, my glaucoma is caused by an attack of a virus that causes pressure that then affects the nerve, and therefore the nerve now causes glaucoma. So gradually, if every time I don't go for treatment, my left eye will begin to deteriorate until eventually I go blind. So they create a new drain so that when the pressure builds, the pressure will flow out of that drain. And therefore, it will not put pressure on the nerves, Therefore, the glaucoma will be controlled. And I think that he has done effectively. But at the same time, it caused me another problem. If you look at my eye, one left eye is smaller than my right eye due to the eyelid being stretched. And because of age, your eyelid has lost its muscle. Now they probably have to do surgery to bring it right back again. Hopefully, then it means another surgery is due.
Although his left eye keeps winking consistently and is now 1/3 smaller in size as compared to his right eye, Peter has no complaints.
Currently, I'm enjoying life. I do a lot of fishing when the fishing season is in. When the fishing season is not in, we will travel. And when I'm not traveling, not fishing, then it's gardening. And then DIY, repair toilets, repair house. And so I'm very, very busy in that context. And having good fun.
I can't believe that the deterioration happened within the hour. He said it suddenly went cloudy, and of all places, in the shower.
So his is a unique situation, or not so unique. His was a secondary glaucoma. That means
It was an infection,
secondary due to something else that caused the glaucoma. In his case, it was the possible viral infection. It hasn't fully been diagnosed by the previous doctors who had seen him. And then he finally came to me, and I saw that. I tried to tie it together because usually there's a natural cause. And here we found out actually it was the eye drop causing a significant allergy. So all I had to do was remove that eye drop, put him on different treatment, and that allowed him to keep a low pressure. But it did not solve the underlying problem of that recurrent inflammation. So I got a colleague who specializes in inflammatory diseases to try to control that better, keep the eye more quiet, so that when it's quiescent, it's more stable. I said, now that I've gotten your eye under good control, less inflammation, let's do this procedure. We did it. We achieved success over the last, it's been 6 months now, I think. But this is a lifelong disease. Glaucoma is a lifelong disease, and we need to regularly monitor him. And if anything goes out of whack, we need to step early to prevent any loss of vision, which so far we are doing.
Okay, Dr. Jayant, can glaucoma be deferred or prevented?
The single biggest risk factor in you going blind from the disease is the stage at which we pick it up. So if I pick up the disease by the time you have symptoms and it's already poor vision, to be honest, the chances in you preserving vision is slightly lower. So for example, that photo that they're showing, the right side is the right-hand side visual field, left side of the screen is the left-hand side visual field. This is a normal visual field. When we compare one eye at a time, and we shine lights at the side, and then we see how much of the light, even if it's dim, are you able to see it. If it's normal, it comes as white. You can see the bottom part of the screen is literally no defect.
Yes.
The next photo will show you in a patient with advanced glaucoma. It's not that they're seeing black, it's that their vision in those areas in the right eye and the left eye is significantly lower than a person without glaucoma. And so this test will allow us to check how much of your vision is affected. And the next photo will tell you how we assess the nerve structure. When I compare your right nerve, which says ODR, that's the right nerve, and the right side of the screen shows OSL, that's the left side of the nerve. I compared your nerve structure to people of your age group. If it comes as green, it means it's as thick or as healthy as people of your age group. As opposed to the next picture, which will show you that in a patient who has glaucoma, the lower part of the nerve is a bit more thinned out. And that represents, for example, glaucoma.
So, Doctor, you're mentioning that glaucoma is a lifelong kind of thing.
Condition. If you're diagnosed with it, yes.
Okay, the Peter Lim in me is asking this question. So what are the do's and the don'ts if you have a glaucoma condition?
First of all, if someone suspects you to have glaucoma, see a doctor who's trained in glaucoma to diagnose it, because sometimes it can be tricky, because each type of glaucoma has different treatment options. The idea was the concept is this. If you're diagnosed with glaucoma, your nerve is being damaged. I need to protect the remaining nerve and save your vision. Okay. Second concept, how can I do it? There are some protective agents, which we might come to, like ginkgo. Vitamin B3, niacin, is known to be protective. Exercise, healthy eating is protective. Yoga or deep meditation, because it increases blood flow and stuff like that. That's protective. These are things that you can do.
I see.
But generally, our aim is to lower your eye pressure from what we determine to be the baseline.
Okay, so what is something that you shouldn't do?
Yeah, do I stay away from ice cream?
I think unnecessary use of steroid medication. I don't make steroid to be the bad guy, because steroids are necessary medications sometimes. For certain conditions, you need it.
Yes.
Like autoimmune conditions. Many conditions requires the use of judicious use of steroids.
So if, let's say, 51 years old now, and we're to early stage glaucoma. If I started taking the medication, would I be good for the rest of my life?
Yes, with the medicines that we recommend to lower your eye pressure and you use it diligently, correctly, yes, we can stave off blindness.
Well, that's great news then.
All right, guys, it's time to go for a quick break. But when we come back, it's more fun right here on Everybody Knows.
Welcome back to Everybody Knows.
All right, guys, we've been talking about glaucoma and also touching a bit on cataracts. And Suhaimi.
If I have type 2 diabetes, how much of the percentage of people like me leading towards blurred vision or even worse, glaucoma?
Well, commonest causes of blurred vision in Singapore include, of course, glasses, which can be corrected. That's the easy one. Let's leave that out. But the commonest causes that need correction are cataracts, glaucoma, and diabetic retinopathy. What happens in poorly controlled diabetes is the blood vessels get a bit leakier. They start bleeding. And they bleed in the eye, you go blind. So what do we do to prevent it? Control diabetes. It gets better structural integrity of the blood vessels, less leakage, less swelling, and also the eye is a window to the soul. So if the eye is having problems in a diabetic patient, we do check the rest of the body, the nerves, the heart, kidneys. So diabetes is a systemic disease, the whole body is involved. So the treatment, honestly, is not eye-related, it's more body-related.
Right.
Of course, when it affects the eye, there are things that we can do to do damage control, to laser the eye, to prevent the leakiness, to give injections, sometimes surgery. That's diabetic eye disease. Number 2 is cataract. That's the commonest cause of vision impairment worldwide. And that's, thankfully, a relatively straightforward fix. Like I think you're talking about it, Rahimah, basically.
Yeah.
Rahimah's basically going for cataract
Yes,
surgery
yes,
really soon. Is there any concerns that you might maybe have?
My concern is like, I'm going to be like I know that my eyes going to be open and is it painful or not?
Whatever you've asked is totally fine and your fears are well-founded. Many patients do have this fear.
Yeah.
Here's an interesting fact. Everyone's going to get cataract. As we get older, our lens will get cloudy. As long as beyond the age of 50, almost everyone gets a cataract. So when you see a doctor, he tells you you have mild cataract, don't worry, it's okay. But if it starts affecting your quality of life, which it seems to be doing in your case, that's when I need to do something about it. And what do? We make a small incision, 2 to 3 millimeters only. You will not feel any pain.
So you won't feel
You will not feel
anything,
you'll feel
anything,
comfortable,
yeah.
and the anesthetic keeps you calm and sedated so that you can allow, the aim is for you to chill while I do the work.
Because the thing is, before the surgery, it's like we got to fast.
Okay.
That's the main
The reason
concern
for
of
that
us.
is in
Like,
case
why?
so we use anesthetists so that we can keep you sedated. And for sedation, it's important that you fast. We don't want you to regurgitate.
You need to schedule an appointment with him. I need to wrap this show up. Doctor,
Okay.
thank you so much for joining us. Appreciate
pleasure.
it.
Thank you, Dr. Jayant.
Suhaimi, thank you guys so much. You know, guys, as we age, the health of our eyes may deteriorate. So stay careful and vigilant so that we can continue to see what's around us with optimal clarity and assurance.
It's been Everybody Knows, and join us next week as we delve into another interesting health topic. We'll see you then.
Bye, guys.